I'm Jarel Bakke. I'm a pediatric physical therapist with Kitsap Physical Therapy. And one of the things that I want to talk about in this social media piece is a good reason, how we help you find what your child needs for therapy. So sometimes you just look at your child and say, gosh, something just seems like they're not quite keeping up with the other kids, or it seems like certain things just seem to bother them more. And if you have concerns about it, a lot of times you talk to your doctor about that. And sometimes we'll say, hey, therapy, sometimes not. But I want to give you some ideas of how we determine if therapy is a good idea. So one of the things we use are standardized assessments. And so one of these is what's called the Peabody. And what that does is it helps determine how your child's motor functioning is coming along. So sometimes this is their gross motor, they're walking, they're running, and is that at the age appropriate level it is that they should be at. There's also the fine motor part of that. Are they using their fingers like they should? Can they do buttons and things like that at an age appropriate level? So we can use that Peabody assessment to determine, do they need therapy, or how can therapy help them? Or maybe they're doing great and just keep doing what you're doing and giving you ideas of some games and tools to keep doing in order for your child to keep progressing with their normal development. Another one we use is a sensory profile. A lot of times you'll hear this sensory word a lot, and kids all have, we have those typical senses: taste, smell, hearing, touch, and then kids also have an emerging vestibular and proprioceptive sensory piece, which is vestibular is that ability to figure out where the head is in space, and then the proprioceptive is what are those joints doing, and that's really integral as these children develop for their gross and fine motor skills. So we give them this sensory profile that gives us an idea of what areas might be a little too sensitive and what areas might need a little more work to be a little more sensitive in, and that gives us a lot of insight into who your child is and maybe what their needs are. And so that's our goal. Our goal is to find out ways for you to better understand who your child is so that they can meet those milestones, be successful in school and in community activities, and just to give you a better understanding of who they are. So if this sounds like something you might be interested in, contact one of our pediatric locations, which are here in Silverdale and also in Paulsbo, and give us a call and say that you'd be interested in one of these assessments, and we can work with your doctor to get a prescription. So my name is Jarel Bakke, and thanks for your time.